So we are on chapter 8, which is the last chapter in module 2, and it talks about treatment for depressive and bipolar disorders. I'd like to highlight one specific treatment very commonly used for depression. And I'm not going to talk about medication. That's something that's important to be familiar as well, but I will focus on cognitive behavioral therapy. Now, you may have read in the previous chapter a very important sort of cognitive approach to understanding and treating depression that was developed by Aaron Beck. He talked about the cognitive triad of depression, which would include the negative view of self, the world, and the future. And that is something that is very commonly observed among people who have been diagnosed with a depression. Okay? They typically don't feel good about themselves or the people and the world around them, and they don't typically have a lot of optimism about their future. And Beck highlighted, as part of his cognitive therapy, the tendency to develop these negatively biased automatic thoughts. And so cognitive therapy for depression would typically involve helping the client look at their thinking as though they were an outside observer, okay? So the therapist would say, I'm noticing that you're mentioning a lot of negative things about your school performance and you don't believe that you can finish school. How about we look at those thoughts and see how they compare to the actual reality, okay? And the therapist would explore the person's performance in school. And he or she would ask a lot of questions. And then the therapist would point out that, you are having these sort of automatic thoughts that really don't do justice to how well you have done, right? Let's look at how we can challenge these thoughts together. And the therapist really works cooperatively or collaboratively with the client on challenging those thoughts and coming up with alternative thoughts that would more closely match the reality, okay? And so the person is sort of trained to catch themselves in the midst of an automatic thought, take a step back, challenge that thought, and adjust that thought to make it more realistic. And by changing the thinking, the person can actually end up feeling better, okay? The cognitive approach typically involves a lot of worksheets, writing things down, challenging statements, alternative responses and thoughts. It's a lot of thinking and writing and really intervening on the level of thinking. The behavioral approach, which is typically another important component of treatment, the CBT treatment or cognitive behavioral therapy for depression, addresses something I mentioned on the previous video, which is that one of the hallmark symptoms or features of depression is deactivation, low energy, low interest, low enjoyment. And so the therapist will actually encourage the client to do more, to engage in more activities that would be potentially rewarding or enjoyable. And that approach often is referred to as behavioral activation. So for example, I would say, well, what did you used to do before you became depressed that you enjoyed? And maybe the client says, well, I really enjoy talking to my sister. I used to talk to her almost every day. I would say, well, how often do you talk to your sister? Well, maybe once every 2 weeks. Well, how about you make an effort, and that could be a part of homework, and call your sister every other day and tell her you have 5 or 10 minutes if you think it would be too taxing to talk longer. Okay? And that is a form of behavioral activation where the client is instructed to do more of the things they used to do in the past that were rewarding. And the goal is to activate the client and to remind them that they can experience some enjoyment in the same activities they used to enjoy. Maybe it's not the same level, but they can still enjoy it to some degree. Okay, and again, there's sort of a homework component here, right? The person needs to think about what they're going to do in the next week, typically write it down, go home and do those things, and then come back to the therapist and report on how it went, tweak it, make adjustments, and do the same thing or something slightly different the following week. Okay, I'm going to pause here. Thank you for your attention, and I will see you next time. Bye.